This
as well, red
conference
and
will
brown.
now be recorded.
And the ideal conditions for growth for cyanobacteria are high-ish temperatures. So we're looking at temperatures above 20 degrees Celsius, although we do see blooms in lower temperature areas, and we have evidence of under ice blooms in some parts of Canada at times of the year. They also prefer high nutrient conditions. So that's looking at high nutrients, meaning nitrogen and phosphorus. And with climate change, there's likely to be an impact on the occurrence and frequency and duration of blooms across Canada. This is partly due to the effect on temperature, but also other climate-related effects, such as precipitation and storm patterns, which could affect nutrient loading, things like wildfires too, and how those impact nutrient loading into freshwater systems. And the main, what we're looking at with blooms, they can be localized or they can be widespread, as you can see from this image from Lake Erie from 2015. And they can be impacted by things like wind and water conditions, so they can move around. They're not necessarily static. And blooms can appear and they can move and change quite frequently and quite quickly. In some parts of Canada, people are quite aware of these blooms because they see them everywhere or every year on their recreational lakes or maybe where they go to their summer cottage. But other people may only become aware of the risks of cyanobacteria when they see events like this, such as deaths of pets that have been exposed in freshwater systems, or perhaps cattle. And those have impacts on economic aspects as well if you're dealing with livestock losses. But hiding behind those events is a more sinister issue, which is the possibility for quite serious impacts. And this example here remains the most serious event that's ever happened as a result of cyanotoxin poisoning, which was at a hemodialysis clinic in Brazil in 1996. There was over 100 patients there that were receiving hemodialysis fluid that had been produced from cyanotoxin contaminated water. Over 100 became ill and more than 50 died. The links back to a specific cyanotoxin there. And following this, the World Health Organization then implemented the first provisional guidelines on cyanotoxins in drinking water. So when we're looking at cyanotoxins, there's 2,000 plus species, and about 5% of the species produce toxins, although these 5% of species are quite ubiquitous in the environment, so they might be more frequently detected. Not all cyanoblooms are toxic. Between 25 to 75% may contain toxins or toxin-containing bacteria. And there's around about 100 plus principal toxins and their variants, and some of those are detected more frequently than others. In Canada, microcystins, and elsewhere actually microcystins is probably the most frequently detected, but that also has the most number of variants, something between 80 to 100 variants of microcystins. They typically fall into two categories of hepatotoxins or liver toxins and neurotoxins, but also have general acute effects such as gastrointestinal illnesses, irritation of skin, eyes, fever, pneumonia, these types of things. Chronic impacts of these toxins are less well studied. Microcystin LR, which is one variant of microcystin, has been declared to be possibly carcinogenic after chronic exposure. Other toxins such as BMAA has been looked at for links to ALS and dementia, so neurotoxicological conditions there. So following the WHO implementing their provisional guideline, which was for microcystins only at 1 part per billion, most other countries that now have guideline values for cyanotoxins have built that on that initial guideline. So for Canada, our maximum acceptable concentration set by Health Canada is 1.5, and that differs from the WHO limit based on the fact our drinking water consumption patterns and body weight are different from the global averages used by the WHO figure. In 2018, there was a slight change to the Health Canada guidelines, so we now look at microcystins total rather than just microsystems LR, which was the previous guideline. And there was a new bit of information with regards to caution when looking at microsystems above 0.4 parts per billion, and advice to avoid use of drinking water at this level for the production of infant formula, so seek alternative uses. As you can see, Quebec is the only province to contain or to have a guideline for any other or cyanotoxins, which is anatoxin A, but no other provinces have taken up a guideline. In the US, some states now are looking at other limits for other toxins, but there is quite a variation there, and testing and monitoring is voluntary. So what is the occurrence of blooms in Canada? Well, we typically see them between June and November, but there's evidence of blooms happening all year round. We have one that extended into January 2019 here in BC on Vancouver Island, and there's some, as I mentioned, under ice blooms that are seen. What we do see is that the season seems to be expanding, and if you look at the charts at the bottom of the page there, the date between the first report of an algal bloom and the last report of an algal bloom in the last 2 decades is getting wider. So we're looking at a trend for a longer bloom season. That may be related to climate change. It could also be related to increased awareness and increased reporting of blooms amongst residents and authorities as well. From what I could find from reports of 2018, there was about 150 across lakes and reservoirs in Canada, although this is probably a low estimate. For example, Quebec changed their reporting procedures for cyano blooms in 2016. In the decade previous, they reported between 100 and 105, say, on average per year. And in 2016 and 17, it was only 8 and 2 blooms respectively. We didn't have a report for 2018 at the time of reporting here. So when we're looking at which water bodies are affected as a result of blooms, obviously we're looking at surface waters, which is lakes and reservoirs. And they're more at risk than deep groundwater sources, although groundwater that's under the influence of surface water sources, so shallow infiltration basins or shallow wells near a water body, could also be affected. There have been evidence of affected drinking water sources in all provinces except for Prince Edward Island, where all of the municipal source water is groundwater. And approximately 4 to 5% of drinking water treatment plants have identified cyanobacteria as an issue in the source water. So I had a look to see what we could find in terms of, has there been any evidence of health impacts on Canadians from cyanobacteria contamination of drinking water. There's no records of acute poisoning events that have happened in Canada. The report by Levesque et al. From 2014 studied 267 families in Quebec, and there was some evidence of mild increases in mild symptoms for those residents who had been supplied by drinking water that had been from a source water affected by a cyano bloom. Around the world, there's only been about 27 drinking water acute toxicity events and 3 hemodialysis, of which the worst event was the one mentioned in Brazil in 2016. Chronic illness is much less well studied, and we don't have any evidence of chronic impacts in Canada. That's not to say that they're not there, but there is limited study. Globally, the studies are quite limited as well. In China, there's some evidence of carcinogenic effects as well as liver damage in children that are supplied by contaminated water. And in Ohio, also a study of microcystin carcinogen effects, but inadequate data and long-term studies there for us to make any definite conclusions. And one of the issues related to why we don't have enough data is the challenges to identify cases. So many of the symptoms of acute exposure are going to be quite generic. They could be confused with other types of enteric viruses or enteric bacteria, so gastrointestinal illnesses. Health providers are unlikely to be looking specifically for cyanobacterial illnesses because it's not something that comes up very often, so it may not be on the radar. There's no diagnostic tools to say this is your illness is caused by cyanotoxins, and there's no formal reporting mechanism. So if there had been events that we could link up to bloom events, we don't have records to be able to do that yet. For drinking water users, often it's an unknown exposure level. We don't know necessarily at your tap what quantity you're being exposed to. And drinking water users, whereas if you're looking at a lake that's contaminated by a bloom, you can avoid that. However, if you're opening your tap that has a low level of microcystins or other cyanotoxin in it, you might not be able to detect that. Also, monitoring across the country is sporadic, and data on historic levels is not always available. And for unregulated small and private water systems, very unlikely that there's any monitoring being done for these ones at all. So the effectiveness of drinking water treatment, we looked across reports of whether cyanotoxins are being detected in treated drinking water. So for municipal treatment plants, we have about 88% of Canadian households that are supplied by municipal plants, and municipal plants tend to use multi-barrier approaches that are more effective in treating cyanotoxins, where they can remove both the cells and the extracellular toxins, so toxins that are removed by removing the cells. They don't make their way into the water. And then if there's subsequent treatments that can then remove the toxins that remain, that's the most effective. The majority of treatment plant water sources have never exceeded the maximum acceptable concentration for microcystins, but exceedances do occur on occasion. For example, in Quebec, for the period 2006 to 2012, there were 31 do not consume orders that were directly related to cyanotoxins in the drinking water source. So in Quebec, there's also more monitoring than in some other places, so these are being detected, and you're seeing also more do not consume orders. Some of the key risks for the drinking water sources is when there's a bloom near the water intake. So if that intake can be moved, that can help prevent bringing those cyanobacteria into the treatment system. Pre-treatments that kill cells can also result in release of toxins. So we're talking about oxidants that could burst the cells prior to something like filtration, and those can make their way through into the treatment plant and are harder to remove once they're removed from the cells. It's easier to remove the cells first. There's a recent report just out by the Water Research Foundation, if anybody's interested, and it's looking at what the effect of different pretreatments is on both the intracellular and the extracellular toxins, and trying to find out which one might be the best for your specific treatment plant. So that's worth looking at. Lack of system maintenance can also have an impact too. So if cells are building up on a filter, over time they might be releasing their toxins even though the cells themselves have been removed. There could be cell degradation that results in release. And small and private systems, they're a different kettle of fish, and we're looking at about 12% of Canadian households that are not supplied by a municipal supply. Don't know exactly how many of those are from source waters that could be affected by cyanotoxins, but we're looking at small communities, rural homes and businesses, potentially seasonal properties on affected water bodies. And often they might have disinfection only or no treatment systems. So disinfection in itself, chlorination could cause more impacts, and boiling water doesn't get rid of the issue. It doesn't degrade the toxins. So advice during a bloom for these types of sources is usually to seek an alternative supply. This could be a key challenge because sometimes an alternative supply isn't available. And what's the length of a bloom season? It could be advised for the entire bloom season to seek an alternative supply, which isn't necessarily a very practical measure. One of the issues is lack of simple monitoring and detection tools that could be used by these small systems to be able to know whether they are at risk or not. And also lack of suitable treatment technologies. And Tory's presentation after this one is going to look at some of the study they did on treatment technologies. So I'm just going to cover the next section quite briefly because we're pressed for time, but we looked at a provincial scan of what the current practice is with managing risk of cyanotoxins in drinking water. I'm not going to go through each of the province's results, but you can look at the full report on our website. But typically the approach is assessing the situation, which water bodies are vulnerable, planning for a response, carrying out monitoring, some type of advisories and risk communication plan, and then looking at mitigation and treatment systems. Key challenges for assessing the situation is knowing which water bodies to target and who is responsible. Is it the Ministry of Environment, who typically cover recreational water bodies, but for drinking water sources, it might be the utility that is carrying out the risk assessment. If we look at Alberta, they're incorporating cyanobacteria now into their drinking water safety plans, which is a partnership between Alberta Environment, Alberta Health Services, and the utility operators. Of about 135 water bodies affected by cyanotoxins in Alberta, about 21 of those are drinking water sources, which they've identified now. So now you know where your vulnerable supplies are, you can take further actions. Planning for a response usually involves multiple agencies, and there's a Health Canada protocol flowchart, if you will, that most provinces use as a basis for, and you can see this in larger font on the Health Canada website or in our report, but it involves who is responsible for various steps. So monitoring, what alert levels will you take action at, who will take action, and what types of actions are those. BC have developed a new protocol, adapted their protocol for 2018 for recreational and drinking water sources, and is slightly different in that most other systems use visual confirmation as the alert level, whereas they use as well nitrogen and phosphorus levels as potential for actions. Monitoring is a key area of challenge here for everyone. Who is responsible, as we say, recreational water bodies versus drinking water bodies, and monitoring of small and private water systems, which is very limited, and individuals who are running maybe smaller private water systems may not know what types of tools are available for monitoring. Across the country, there isn't really standard practice in what to monitor. So do you measure cells? Do you measure cyanotoxin levels? Do you just measure nutrient levels, chlorophyll A? So that standard practice is not necessarily there. Laboratory tests are better for giving you an accurate result in terms of what concentrations of toxins might be present. But a key issue there is the turnaround time between sampling and results, and that could be up to 3 weeks turnaround time, which is a key barrier for responding to an event, especially when your protocol states you take action after the results have confirmed your toxin levels. 3 weeks, the bloom will probably be gone, and the risk was there previously. So that's an issue, and there is a need for rapid, cost-effective, and accurate field monitoring tools, as well as standard methods. Also, access to data, whether it's historical or current data, is limited, although some health authorities and agencies are improving their access to data. In Public Health Sudbury District, you can now look at various lakes and what their bloom record is at different times of the year, so you can see are you on a lake that might be affected, and what months are you likely to see a bloom. Alberta Environment Public Health Information Network is now also publishing data in terms of cell counts and microsystems throughout the bloom monitoring season, so you can pick lakes and you can compare between. So this is some way that's improving access to homeowners or to public health agencies to see which lakes they should be concerned about and what types of levels they're seeing. Advisories is also an issue. When do you issue this? When do you rescind it? Do you issue an advisory for the whole season, or do you just limit it to the start and the end of the bloom? And how about getting the message out? Signage, door knocking, social media, and how do people go back to look at historical records of advisories? They tend to disappear off many websites at the end of the bloom season, so you don't know what happened the year before. I won't touch much on mitigation and treatment, but there's some of this covered in the report. But one of the issues here is also who's responsible for mitigating this. And most of the mitigation activity is reactive rather than proactive. You're taking actions after there's been an event. And there's sometimes jurisdictional issues there too. Is it a recreational water? Is it a drinking water source? So just in summary of some of the key knowledge and practice gaps, and I know I've kind of done a rapid skim over what we've covered. There is a need for better access to current historical monitoring data and a link to health data. So is there any way we can tie that up? And in the US, there's now that are the OHABs, which was linking health and event data. There's also lack of data on chronic effects and chronic issues. What is the impact of an expanding cyanotoxin bloom season on Canadian drinking water supplies, and research gaps on the mechanisms and level of toxicity. The lack of universal indicators and standard methods of sampling and analysis prevent us from doing some comparison between health regions in the same province or across the country. And lack of rapid and reliable field tests means we are a bit reliant on laboratory confirmation, and that reduces our ability to provide timely actions. There's that uncertainty over exposure in small and private water systems and what the best practical advice for those water users is. And in drinking water treatment plants, there's still work to be done on standard operating procedures for various levels of cyanotoxin risk. Underneath all of this, the coordination of multiple stakeholders could benefit from local champions who are interested in cyanotoxins, as well as organizational leadership. So we are looking at taking some of these issues forward and talking about them further. If you are interested in helping that discussion and maybe sharing ideas, information, common issues, we'd be seeking your feedback on whether a national knowledge exchange forum would be valuable. So please contact me or contact us afterwards, or provide it in the feedback at the end of the webinar if you can. And I will now pass you on to Tory. Thank you for listening.
Thank you, Juliette. So I'm just passing the presenter right now to Tory.
All right. So good afternoon, everybody. So my name's Tory Colling. Thank you, Tina, for passing me on. So today I just wanted to touch on, before we jump into the cyanobacteria work that we've done at the Walkerton Clean Water Center, I just wanted to touch base on just going to move our, there we go. I just wanted to give some information about the center itself. So we are located right in Walkerton. So if we zoomed into Ontario, we're located in Walkerton, but we are an agency that was established by the Ontario government, specifically the Ministry of Environment, Parks, Conservation and Parks. So what we did is, this was in place to respond to an action item to respond to the Walkerton water tragedy that took place. And although we are located in Walkerton, we do serve and cover the entire province of Ontario. Specifically, our mission at the center, we exist to provide education and to support our clients as they address their water system risks in order to safeguard Ontario's drinking water. And we strive to achieve this mission through delivering drinking water education, training, and support to owners, operators, and operating authorities of drinking water systems. So we do this through coordinating and developing and delivering training across the province of Ontario. And we also do pilot testing, which we'll touch on a little bit here, some of our results that we've done. Specifically, we're here because we want to talk about cyanobacteria you would typically see, or it's commonly described as if blue or green paint had been spilt across the surface. And that's a very specific characteristic that we see with blue-green algae or cyanobacteria. It almost has an oily feel to it. And as Juliette had alluded to, there are certain times, there are only about 5% of the times that you see that these blooms are actually, these cells are producing toxins or cyanotoxins. There's quite a lot of variability in terms of what type of genus or species you could find in the blooms. But if we were to take a sample of that green water and look at it under the microscope, we would see something like this, where you'd see lots of individual cells. And specifically, Microcystis is one of the more common cyanobacteria genus that's found in Canada and Ontario. Usually it's implicated with toxicity. It can produce the specific toxins, microcystins. But Microcystis is not the only producer of these toxins, microcystins. So there are other genera out there that can produce microcystins, such as Planktothrix or Nostoc. So there are, or also Anabina is another example. Of all of the toxins, there's also a variability with or a high amount of variability with the toxins themselves. So here are some examples of different toxins that can be produced by cyanobacteria. Anatoxin has an effect on the nervous system. Saxitoxin is also a neurotoxin. Microcystin is tumor promoting, but also is a hepatotoxin or can affect the liver. Nodularin is another one that can affect the liver, and cylindrospermopsin is one that can affect the liver and kidneys and also has tumor promoting effects. According to the Health Canada new guidelines, anatoxins, microcystins, and cylindrospermopsin were key ones that were looked at. They're more common in what you'd find in Canada. Specifically, if we just look at microcystin, we even have variability there. So we're looking at over 70 different variants or types of microcystins just within this microcystin group. Specifically, the microcystin LR is the most common and toxic variant of all of the microcystins. And there's a guideline that Juliette had done a great summary on the guidelines for drinking water. Specifically, Health Canada has the drinking water quality guideline for total microcystins as a new maximum acceptable concentration at 1.5 micrograms per liter. And for Ontario, we also have the Ontario Drinking Water Quality Standard set to 1.5 micrograms per liter, and that is of microcystin LR specifically, so not looking at total microcystins, which would include all of the other variants. I did want to touch on the effect of cell density. So if we have a big dense bloom with lots of cells, that doesn't necessarily always relate to indicating that there's a lot of cyanotoxins in that water as well. So most often toxin-containing blooms that are not dense will have very low levels of toxins, but this is not always the case. So there are some cases that you've seen very low blooms that you can't really detect, and you actually see high levels of toxins. A specific characteristic that's unique to these cyanobacteria cells is that they have a tendency to float and move within the water column. So they contain gas vacuoles that can allow them to move up and down within the water column throughout the day. So the cells will migrate near the surface of the water column to capture the light for photosynthesis. And then throughout the day, they will then regulate their buoyancy by affecting their gas vacuoles and sink deeper within the water column. And at that point in the deeper water column, they would achieve their nutrients like nitrogen and phosphorus. And so at that stage, if they're lower in the water column, you may not be able to detect it visually from the shore. And also with drinking water treatment plants, your intakes are usually lower in the water column as well. So although you may not visually see it, your intake could be still capturing some of the bloom. This is an example from Ohio EPA. where they had a cyanobacteria bloom detected, so it had a dense cell levels, but there were no toxins actually detected at the intake of the water treatment plant. And this was a photo was taken in Lake Erie in 2011. Whereas if we compare this example, we have the same site here, Ohio EPA in 2011, specifically looking at the Maumee Bay State Park. They did not visually see that there was a bloom that was present, but they did find high microcystin levels at the intake of the water treatment plant, around 5 micrograms per liter, and the microcystin levels near the beach were above 100 micrograms per liter at the time, even though they weren't able to see a clear bloom at the surface of the water source. So in terms of drinking water challenges with cyanobacteria, I just wanted to summarize some of this. First off, we are dealing with 2 different forms of toxins. As this bloom starts to grow, the cells are usually healthy. And so here, this picture that I have here are healthy cell-bound toxins. The toxins are represented with the darker green circles. And this is showing you a healthy cyanobacteria cell as an example. As the bloom starts to age, the cell walls start to degrade, and then these toxins are actually then released into the environment. So these are considered your unhealthy cells, and they can release into the environment. And because of that, we actually see that there's a difference in how you can handle both forms, whether they're cell-bound or release toxins. And so as the bloom starts to age, we do see 2 different forms. Also, some treatment processes can actually cause the cells to rupture, and that would be an example of oxidation that Juliette had mentioned earlier. Any type of pre-treatment, if you pre-chlorinate your water treatment plant for zebra mussel control, that will actually cause these cells to rupture, and then you're releasing the toxins as well. So usually, as best practice, water treatment plant operators may stop pre-chlorination during a bloom event. At the same time, I've also heard the other idea of, well, at least if we pre-chlorinate, or if you're bursting the cells, then you know what you're dealing with throughout the treatment process. So that is a view of some, but the overall general consensus is we want to avoid rupturing them, try to capture them while they're still intact, cell bound within the cells, and then because that's usually easier to handle. Another challenge we face is different treatment processes will actually affect the different forms of toxins, whether cell-bound or released. So for instance, treatment A may be effective at removing these intact cells, but have a hard time or unable to oxidize or unable to treat the released toxins, and vice versa. So treatment B might be effective at handling the released toxins, but not so much at the intact cells. And lastly, treatment effectiveness will vary with the different types of cyanotoxins. So we're really just touching on microcystins, but we mentioned anatoxin or cylindrospermopsin, and these may have different effects or susceptibility to treatment processes as well. So for a water treatment plant, a larger municipal water treatment plant, they have multiple treatment processes, and those treatment processes are capable of achieving and removing both cell-bound toxins and release toxins. Because as long as you have one, for instance, conventional treatment is effective at removing these cells, keeping them intact and removing them out of the water, and then follow that, your chlorination or oxidation of some sort is capable of, as long as it's a high enough residual, would be capable of removing the release toxins. So with a larger water treatment plant, usually the multiple treatment processes allows you to deal with these challenges and handle that. However, the smaller drinking water systems may not have that same level of multiple treatment processes or stages. In Ontario specifically, there's approximately 18,000 small drinking water systems that are governed by the Ministry of Health and Long-Term Care in Ontario. So these are our small drinking water systems. And actually, a more recent number I just received has actually declined to 10,000 small systems. So we looked at this and wanted to see how much information is out there, and we found there was very few studies that actually looked at the effect of small drinking water system technologies on how to remove cyanobacteria or cyanotoxins. Currently, the overall consensus is if you suspect a bloom, to not use or trust your household unit or a small drinking water system at this stage. But really, there's not a lot of information out there to go off of. So we completed a literature review where we looked at different studies that had looked at smaller systems. So these could include point of entry, so that would be a unit that would treat water going into an entire household, or a point of use system that could almost be under a tap. So a treatment that you'd have under a sink to just treat water right at that, at the use or at the sink or at the tap. And very few studies were out there, and so we summarized them just by kind of semi-qualitatively here. We ranked them effective, moderately effective, or ineffective based on their results. And we found that here we have the diamonds are representing studies that looked at the cell-bound form. So how well are these treatments able to tackle or remove the intact cells? And the X's represent the released toxins. So the first study looked at carbon-based filters and fiber-wound and pleated paper filters. And they found that the carbon-based filters actually did remove 99% of the microcystin LR. So we ranked that as effective. Whereas the fiber-wound and pleated paper only removed about 5% of microcystin LR. This study did not look at the cell-bound form, so it only looked at the released toxins. The other study looked at an ion exchange resin and granular activated carbon, and they found that depends on the cell shape and size. So some of these cyanobacteria cells are filamentous, so they were actually more easily captured than smaller single cell cyanobacteria. So because of the cell size, the filamentous ones or the larger ones were captured, 60% of the cells were removed, whereas those smaller single cells only found 10%. So we found that we ranked that as moderately effective because it would depend on the cell shape and size. For the same units, they looked at the released toxins, and they found about 40 to 57% of the microcystins were removed. But to achieve this, they had to pre-rinse the filters, flush them, and filter them repeatedly. So we thought that was impractical. So that's why we ranked it in between moderately effective and ineffective. Reverse osmosis was another unit, another study where they've looked at reverse osmosis, and that has been shown to have effective removal of these toxins. And lastly, ultrafiltration, which would be something commonly found in small drinking water systems. You would need a dose that would be much higher than a typical dose you would use at a household level or at a small drinking water system level. So we ranked that as ineffective or moderately effective. So after our literature review, we set out an objective to investigate the effectiveness of typical small drinking water filter systems on cyanobacteria cells and the toxins microcystin removal. We looked at reverse osmosis, nanofiltration, ultrafiltration, ceramic microfiltration, carbon block filtration, ion exchange, and a slow sand filtration. So we looked at a whole bunch of different technologies that would be suitable for small systems or even a point of entry type of system. We sought out a natural occurring bloom. So we found a bloom that had been pretty high in the cell counts or in the discoloration here. And we collected that with a water hauling truck, and we drove that to the center here. So at the Walkerton Clean Water Center, we have a large tank that's 40,000 liters. And so what we did is we filled that tank with this natural occurring bloom, and then we pumped the water into the different water treatment technologies. So the technologies that we did before we looked at the systems that we had just mentioned, we wanted to include an effective pre-treatment process as well. So when the water passed through the different treatment processes, the first process it hit was a 20 micrometer cartridge filter, followed that by a 5 micrometer cartridge filter, and then a 1 micrometer cartridge filter. We did the two 1 micrometer cartridge filters side by side just to reduce the load on the filter. And then we ran the water into the final treatment filtration process. So we had a reverse osmosis, a nanofilter. We ran the water through ultrafiltration, a point of entry carbon filter. So that would be a filter suitable for treating water for the entire household, and a point of use carbon filter, which would be more practical for under a sink type of unit. A point of use ceramic microfiltration, and then an ion exchange unit as well. This ion exchange unit was used specifically to remove organics from the water. That was the resin that we had used. And we also did a slow sand filter. And typically with a slow sand filter, instead of these cartridge filters as a pre-treatment, we had included a roughing filter, which is basically loose gravel in a column. So we repeated these experiments 3 times. We ran the water through the unit 3 times. We collected water samples at time 0, which was essentially 15 minutes after we had started to allow for enough water to pass through all of the units to treat it as time 0. Then we sampled our ultrafiltration at 4.5 hours, and then the remaining treatment processes we sampled at 6 hours. And that was just due to the fact that we wanted to make sure we had enough water to do 3 whole runs. So ultrafiltration was using quite a lot of water, so we cut that off earlier than the remaining technologies. We analyzed our samples for cyanobacteria cell counts with an accredited lab. We did ELISA in-house, so that's an enzyme-linked immunosorbent assay, to specifically look at microcystin LR equivalents, so that would include other variants. And then we looked at, through the Ministry of Environment Lab Services branch in Ontario, we did the microcystin variant using their liquid chromatography mass spectrophotometer. And we looked at other water quality parameters as well, which I won't dive into today. So what we found is what I'll show you here is on the vertical axis here, we have the percentage of total cyanobacteria cells removed. And each color of the bars, these are going to be stacked bars. So each color of the bars represent a different stage of the water treatment plant. So the darker the stage is the earlier of the 20 micrometer cartridge filter, followed by the 5 and the 1 micrometer cartridge filter. And then the white will be the final treatment stage. So for reverse osmosis, we found that and we also outlined the dotted part is the pre-treatment, and the solid line would be the final treatment. So the total bars represents the total removal that we see, including all of the stages altogether. And so we did find that for the cells, majority of the cells were captured at the 20 micrometer cartridge filter, so that darker gray bar, and then the 1 micrometer cartridge filter. And any remaining cells were fully captured and removed using reverse osmosis, which is that thin white bar on the top. We found the same similar type of trend with nanofiltration, except for majority of that removal was done with the lighter gray at 1 micrometer cartridge filter, and then any remaining cells were completely removed using that final treatment with nanofiltration. The same idea with ultrafiltration, so any remaining cells that were present after the pre-treatment was removed with ultrafiltration. And then this actually worked out the same way for ceramic microfiltration as well. Any remaining cells that came out of the pre-treatment was actually completely removed with ceramic microfiltration. We found the same for carbon block filter, so majority of our removal was the 20 micrometer cartridge filter of cells, the lighter gray at 1 micrometer cartridge, and then again, any remaining cells were just completely removed with carbon block. And our carbon block at the point of use unit, so the smaller unit there, didn't do any additional removal. So all of the removal that we did see of the cells were all because of the pre-treatment cartridge filters rather than the carbon block. And our ion exchange unit as well didn't do any additional. So you'll notice that the ion exchange, that white bar, is on the negative side because we actually had a slight increase in cells compared to what was coming into the ion exchange. So again, any removal that we did see on that unit was all due to the pre-filter. And then lastly, our slow sand filter, our roughing filter, we had a slight increase. You can see in the dark, the gray section there. We had a slight increase in cells, but again, all of those cells were removed at the slow sand filtration process. So we'll go through the same for microcystin LR removal as well for those toxins. And we found that, again, most of our cells most of the toxins were removed at 20 micrometer cartridge filter. And this is probably due to the fact that they would have been cell bound at this point. So we were actually removing the cell bound form of the toxin. So any remaining toxins that were found, leaving the pretreatment stage, was fully removed by reverse osmosis. And the same idea with nanofiltration, we found a similar trend. Ultrafiltration, we actually saw an increase in toxins, and this has been debated in the literature as well. The whole sheer forces of ultrafiltration, there's been discussion of whether or not that's strong enough to break apart the cells and cause those to rupture and then pass through the ultrafilter. And so we suspect that that's what was happening here. So the removal that we do see was due to pre-treatment filtration. The ceramic microfiltration, again, was the same idea. We had slight increase of microcystin LR rather than any removal at that stage. So the removals was really due to the pre-treatment. And then our carbon block point of entry, we actually found very good removal. And so any remaining toxins that were found after pre-treatment was actually removed with carbon block. And the same, we didn't see a big difference between the point of entry or point of use in terms of removing the toxins. And ion exchange was not effective again, so we did see that the removal was due to the pre-treatment stage and that there was a slight increase in toxins afterwards. So our slow sand filtration, again, we saw the roughing filter, or the pre-treatment, was effective. About half, or 40%, was removed, and then any remaining toxins were actually removed after that as well, from the slow sand filtration process. So looking at the bars, the total bars, we were getting very effective removal. It's just a matter of at what stage in the treatment process did you see that happen. So in conclusion, the cartridge filters were very effective barriers for pre-treatment after only 6 hours of operations under these experimental conditions. We had additional stress, so we might have seen, if we had a higher toxin levels or cell counts, we might have seen additional stress on the system. So we may have to look at that because this bloom itself was mild to moderate levels rather than a very high level. And with including our effective pre-treatment that we had set up, all of our treatment processes came across effective, but as long as we have that pre-treatment as to add robustness to the system. So I just wanted to try to rank or put a criteria to all of the treatments. And so what we did is we looked at, now including the pre-treatment stage, which one of these achieved 100% cyanobacteria cell removal, and which ones achieved greater than or equal to 95% of the toxins. And again, this is just a summary of our results for this specific experimental condition. So we need to be mindful of applying it to a different bloom or a different condition. But reverse osmosis met both of the criteria as well as nanofiltration. Our carbon block point of entry and carbon block point of use was effective at the microcystin LR, or the toxin removal. Ion exchange didn't meet either of the criteria, whereas ultrafiltration we did see good cell removal, but we did see an increase in the toxins from the process. Ceramic microfiltration also was similar to ultrafiltration. And then our slow sand filter achieved good removal with microcystin LR. It did achieve good removal with cyanobacteria cells as well, but it didn't achieve 100% of the cells. So with that, I'd like to acknowledge our team at the Research and Technology team at the Center, the Ministry of Environment, Conservation and Parks, the Lab Services Branch, and City of Hamilton Public Health Services for helping us locate a natural bloom. And Sean Cleary from the Humber Institute of Technology and Advanced Learning had helped us with providing us the slow sand filter columns for our pilots as well. So with that, I welcome any questions. Thank you for your time.
All right, thank you, Tory and Juliette. We'll start with questions in the room. Do we have any questions in the room?
Toxin is labile? Or
Sorry, can you speak up so we can hear you on the phone?
is this toxin heat labile or heat stable?
Heat stable. So boiling water won't actually remove the toxins, they'll remain. So the vice, if there is a bloom, is not actually to boil the water, because you might burst the cells, but the toxins are not going to dissipate.
The toxin will be destroyed if you heat the water?
No. Stable. Heat stable.
Okay, we have one question online. For UV typical dose, did that include NSF standard 55 certified system?
That will be one for you, Tory.
Yes. Yes. So that would have looked at those type of systems. So the typical dose of that would have been the 40 millijoules per centimeter squared. And so the UV doses that are known to be effective or has been found to be effective to tackle these toxins would be more at the level of advanced oxidation, so much higher levels than what would be in a typical UV disinfection unit, like the NSF certified one.
Are people trying to, with global warming, trying to see if they can come up with predictions based on temperature and the frequency of the blooms, intensity of the blooms, things like that?
Yeah, so this is one of the needs that we found there for better data that we can use to actually do some modeling, be able to create predictive, although, I mean, you're going to have variations in lake stratification and nutrient concentrations and that thing. But if we did have better data sets that we could tie up between bloom occurrence, cell density, microcystin level, plus things like nutrient concentration, temperature, stratification, weather, that type of thing. Yeah, it is something that people are looking at, and definitely one of the data needs that could be filled.
One of the limitations that you acknowledged, Juliette, was the lack of information on case reports or in both acute and chronic toxicity. What would you recommend, or what has the literature recommended around improving surveillance so that we have better data on the health outcomes and the trends?
Yeah, so the OHAB system in the U.S. is now looking at tying up reports of cyano blooms with events of ill health. So if you go online, you can see some of the outputs from that. That started in 2016. It's part of the NORS in the States. I can't remember what the acronym stands for, but the surveillance of illness. But there's also talk about looking at animals as sentinels for these types of things, so recording where there's maybe dog deaths, livestock illnesses, or wildlife illnesses as well. In some states, they're now making it mandatory to report if there's an event of a cyanotoxin poisoning. So that then becomes part of the data set that you can tie back to. So building that data set of evidence is really the only way that we can improve this.
I had the same question as my colleague Eleni, but also I'd like to ask, if one notices a bloom, what would you suggest is the best way to characterize its potential health effects Would it be through concentration, through speciation, through toxin identification, or through measurement of toxin levels? Going forward, how can we get a better handle on risk?
Yeah, so that's a good question, and it's probably one of the knowledge gaps too, but what is the best monitoring indicator for us? And cell density and toxin level have been shown to not actually correlate all that well. You might have, like Tory mentioned, these high density new blooms, but the toxin levels are not actually there. So toxins themselves is a good indicator, but the lab testing is the barrier there, so you don't get a quick result when you're looking for the microsystem. There's some testing now of real-time phycocyanin, which is like a photosynthetic pigment that's produced by cyanotoxins, which may be a good real-time indicator of a growth in a bloom and that type of thing for indicating that a problem is coming or there's a bloom going to occur or it's getting worse. I don't know, Tory, do you have any input that you would like to add to that?
Yeah, I think, no, I agree with what you're saying. The right off the bat, just looking at the toxin levels, using those ELISA kits or the enzyme-linked immunosorbent assay kits, that would be a good indicator right off the bat. That wouldn't take too long. It's not really out in the field, but it would give you a quick response within a day to get answers. They also have like dipsticks almost, where it acts similar to a pregnancy test that would give you a more field-based unit, but also in conjunction with testing the toxins, if you're able to get cells, get an idea of identifying the cells, then at least you have an understanding of if you're even looking at a species or genus that could be potentially toxic, because you could get a bloom, but then knowing that the genus isn't toxin producing could mean something as well. So really I find this toxins and identifying the cells are really nicely correlated and can have a good hand-in-hand understanding of what you're looking at.
Thank you. I think we'll run out of time, but there are some questions online. I don't know if we can stick around a little bit longer just to finish the questions. So is there a repository for logging HAB events nationally or provincially? Do you know about the Canoe Environmental Exposure Platform?
Yeah, there's no existing one in Canada, and that's what the OHAB system is in the US. But it could be tagged onto something existing. Certainly it could be something to look at. Something that we could discuss if you want to join our national forum on cyanobacteria and drinking water.
Okay, so do MC exceedances occur in predictable locations?
Tory, would you like to take that?
Sorry, could you repeat the question?
Do MC exceedances occur in predictable locations?
Meaning geographical locations of fresh water? Like of the surface waters? Is that, I'm wondering.
I guess, can you predict the MC concentration from locations of blooms?
Yeah. Probably not. Most likely not. One example that I'm thinking of would be, and again, just also based on because the location of the bloom could be different. So just on an anecdotal story, during the bloom in the Toledo area, when there was that Toledo bloom, Pelee Island is in the middle of that lake, and they were getting hits of toxins, but no cells, because the bloom from the Toledo area was kind of, the toxins were percolating over to Pelee Island area. So you can, you're getting the microcystin exceedances isn't really, understanding geographically where you are within the lake may not help give any type of predictions there.
Last question. Can this information be used as recommendation for homeowners, cottage owners based on the study provided for the treatment train to be used?
Yes. So that at this stage, and that's why we wanted to reiterate when I was summarizing the table, this is just for this particular study. It's shedding light on some of the information that really hasn't been looked at yet, but at this stage, we wouldn't, the general recommendation at this stage is if you suspect a bloom and you're taking water from your household and you're relying on a household treatment process, then you would still do not drink that water because this isn't really tried or tested at this stage. As far as I know, there are no NSF certified household treatments unless this has been recently changed specifically to remove cyanobacteria. So at this stage for a homeowner, the general recommendation would be if you suspect a bloom to not drink that water, but we're hoping to shed some light on some of that.
Just to add, there is one NSF set of approved systems, but it is only for treatment of municipal water, so it's already treatment of treated water, so not on raw water.
Okay, thank you. One comment from Sarah about the cyanobacteria workshop from the NRC. That would be good for us to take a look at. And thank you all for joining us today, and that wraps up our webinar.
Thank you.